Good afternoon. Welcome to our class for care of mother, child, adolescent, focusing on the well clients. I am your online learning coordinator, Mrs. Juliet B. Batac. So last meeting, during our first meeting, we discussed partly on the objectives of this course. So that is utilizing the nursing process in the care of mother, child, and adolescent. Now we are going to explore some more on the nursing process. So what is, how it is defined, and what are the steps? Because when we talk about process, this pertains to several steps or procedures involved in the process. So let us define first, or let us have our objective for this afternoon. So at the end of the course, given actual or simulated situations, conditions involving the client. So we have the normal pregnant woman, or a mother, and a newborn baby, children, and the family. The students will be able to utilize the nursing process in the holistic care of client for the promotion and maintenance of health. Di ba ito rin yung na-discuss natin last time as part of the objectives for this course, NCM 5207. Now let us define nursing process. Nursing process is a systematic way to plan, implement, and evaluate care for individuals, families, groups, and communities. So again, we follow several steps in nursing process. So we will discuss each of the steps in nursing process as we continue with our VC for this afternoon. Nursing has an organized structure that helps nurses to efficiently apply their intellectual, psychomotor, and interpersonal skills, just like what you learned in the theoretical foundations of nursing, di ba? We have given several, and we have seen and studied several theories. And yung application of the theories in clinical practice. So now, ito na ngayon yung application that we are talking about. So this is now utilizing the nursing process, and nursing process, again, yung theories natin evolves in 4 concepts. So the concept of health, person, environment, and nursing. Ganun din, same with nursing process. Ito rin ay nakafocus doon sa 4 concepts based on the theories that we have for nursing. Another definition of nursing process. So the classic nursing process. Since the 1970s, the nursing process has been the label applied to an underlying scheme that provides order and direction to nursing care. So again, order. So this nursing process serves as our guide so that we have something to follow in terms of taking care of our patient. So it gives us order and direction. Which one should come first and which one is next in the interventions that we are going to do, or actions that we are going to do to take care or address the needs of our patient. So another definition, nursing process is a tool used by practicing nurses to make decisions and to predict and evaluate the results of nursing actions. So dito pa lang, from the definitions given, magkakaroon na tayo ng idea on what nursing process is and what are the steps involved in nursing process. So another definition here, this is for the students. Students of nursing use the nursing process as they learn to behave as professional nurses in practice behave. So what professional nurses do in the clinical practice, you as students can also do the same while you are still studying this program or while you're still under this program. Okay, another definition, it is a systematic, organized method of planning and providing quality and individualized nursing care. So individualized nursing care, we have to take a look at our patient as an individual with unique characteristic. Okay, so meron siyang unique characteristic that differs this individual from another individual. So meron tayong dalawang patient. Yung approach natin for patient A, may not be applicable for patient B. So that is why we have to consider the totality of the individual. So this is now what we termed as holistic nursing. So we are not focusing on the physical signs and symptoms that we can see or as verbalized by the patient, but we have to consider other factors. So what are these other factors? We have psychological, so we have emotional, environmental. We also need to consider yung kanilang religious beliefs or religion and cultural preferences. So these are some of the factors that we need to consider when we look at our patient as an individual. And that is holistic nursing. Okay, another definition of nursing process, it is synonymous with problem-solving approach that directs the nurse and the client to determine the need for nursing care, to plan and implement the care, and evaluate the result. So problem solving, you have the presented signs and symptoms or verbalization by the patient. Now our role is to identify what is the problem. What causes the problem? That is why it is a problem-solving approach. Parang mathematical equation. Merong ibibigay sa atin na mathematical problems that we need to solve. And para ma-solve natin yon, we come up with the solution, ay kailangan susundan natin yung formula. Same goes with nursing process. So we have to follow a step-by-step procedure. Okay, another definition, it is a gauche approach or goal-oriented, systematic, and humanistic care for efficient and effective provision of nursing care. So remember itong goal-oriented. So we have to set our goal so that towards the end of our planned care for the patient, meron tayong reason to strive and to achieve the goal that we have set initially when we make or we plan for the care of our patient. So ito yung gauche approach. So we have problem solving, we have the gauche approach. So now we will learn the different steps in nursing process. So the common thread uniting different types of nurses who work in varied areas is the nursing process. So the essential core of practice for the registered nurse to deliver holistic patient-focused care. So this is the definition given by ANA or the American Nurses Association. The term nursing process was first used or mentioned by Lydia Hall. Can you still recall si Lydia Hall? Siya yung one of the nursing theories that we discussed in Theoretical Foundations of Nursing. So this was in 1955 wherein she introduced 3 steps in nursing process. So ito yung initial content ng nursing process. So we have observation, administration of care, and validation. Okay, remember these 3 steps kasi itong 3 steps na to will also be part of the modern nursing process that we are utilizing or using in the clinical practice right now. Again, observation, administration of care, and validation. So from the 3 steps, we now go to the 4 steps of nursing process. So my addition or additional letter in the steps in nursing process. So now we call this as APAI. Okay, so what is APAI? A stands for assessment. And dun sa theory of Lydia Hall, assessment is observation. Okay, and then we have P for planning. Planning is based on the gauche approach. Planning is goal-oriented wherein we set our goal. And then we have implementation. Implementation based on the theory of Lydia Hall is administration of care. And then we have evaluation being validation of the care rendered to our patient. So again, APAI, assessment, planning, implementation, evaluation. Now, may additional letter ulit tayo. We have the D. And we now call this as ADPAI. So ADPAI, We have again assessment. This is our observation. We have the diagnosis. So this is an additional content in the nursing process. So diagnosis, this is problem identification. Remember yung isa nating definition, problem-solving approach. This is now the time that we are going to identify what really is the problem of our patient based on the cues presented during our assessment. So diagnosis, we have several lists of diagnosis. You can see this North American Nursing Diagnosis Association list of nursing diagnosis. So marami silang, this is categorized into different systems. So if you want to see, if you have books in medical surgical, books in fundamentals of nursing, books in maternal and child care, doon sa end part ng inyong book, you will be able to see yung NANDA. So, list of nursing diagnosis. Well, how does this nursing diagnosis differ from medical diagnosis? Example, yung patient natin came in with productive cough, fever, difficulty of breathing. Sa medical diagnosis, ang diagnosis most probably is pneumonia. Okay, kasi may productive cough, may difficulty of breathing, meron siyang fever. So it could be pneumonia. That is the medical diagnosis. Pero in our nursing diagnosis, we will not be using pneumonia. Kasi it will not give us yung uniqueness doon sa medical diagnosis. Sa atin, what we are going to do or to use in the nursing diagnosis is possible ineffective breathing or ineffective airway clearance. So yun ngayon yung ating nursing diagnosis. We do not use yung mga medical terminologies to diagnose the patient. We will identify the problem. Okay? So I hope clear tayo doon sa difference between a medical and nursing diagnosis. Sa medical, yung disease condition. Sa atin, we identify the problem. Okay? So now let's go to planning. Yung planning naman, we set the goal. Okay? So mamaya i-discuss natin kung ano yung mga components ng steps na to pag nandun na tayo sa last or modern nursing process. Yung ginagamit natin in the current times. And then we have implementation. Implementation is intervention. So this is putting your plan into action. That is our implementation. And the last for ADPI is evaluation. Now, let's see kung meron pang additional letter for the nursing process. So we started with 3. Now we have API, ADPI. Then we have the 6-step process. And this is now named as ADOPI or ADOPI. So ano naman yung additional letter? So we have the letter O. So assessment, diagnosis, outcome identification. So what now is outcome identification? These are what we want our patient to achieve at the end of our interventions or implementation. What will happen to our patient if we have rendered these different interventions? That is outcome identification. Okay, and then we have planning, implementation, and evaluation. Okay, so ito na ngayon yung current nursing process natin. So we have the ADOPIR. So meron tayong nadagdag na letter R. Okay, so the nursing process is code-oriented. So now we have the additional letter R. So now we have A for assessment, what data is collected. D for diagnosis, what is the problem. O for outcome identification. This was originally a part of the planning phase, but has recently been added as a new step in the complete process. And then we have P for planning, how to manage the problem. I for implementation, putting plan into action. R, Ito yung additional letter natin. Scientific reason of the implementations or the rationale for our action. So each of the actions that we are going to implement dapat may corresponding scientific basis. Okay, so where can we get the scientific rationale? So we can get that from the books that we are using or may mga online sources tayo. But see to it na yung online sources natin ay galing sa author mismo ng books or yung website na pwede natin i-consider as legitimate website. Okay, and then we have E for evaluation. Did the plan work? Okay, so this nursing process worked hand in hand in the formulation of a nursing care plan. So nursing care plan and nursing process, these are the core concept that guides the nursing profession, especially in the clinical practice. So hindi tayo makakatapos without formulating a nursing care plan. Okay, so what now is nursing care plan? So nursing care plan or NCP, kung narinig nyo na from the previous lessons or subjects that you have attended, so NCP or nursing care plan is a formal process that includes correctly identifying existing needs and recognizing potential needs or risk. So let us now go back to assessment and yung ano natin, adopire para we have this understanding of how we do assessment. So assessment is divided into two parts. So we have two categories. We have the subjective and the objective, and we term this as cues. Again, subjective cues and objective cues. That is part of our assessment or the data that we are going to collect. When we say subjective, this is also known as symptoms. When we say symptoms or subjective, these are problems or manifestations felt by the patient. Okay, example natin ay pain. Yung pain, pag sinabi ng patient, masakit ang tiyan ko. Hindi naman natin yan nararamdaman as healthcare provider, di ba? Ang nakakaramdam niyan is our patient. So that is subjective. And then the other category is objective. Ito namang objective is known as sign. So if the patient verbalizes, masakit ang tiyan ko, so what are the signs that corresponds to the verbalization of the patient? So example, the patient is holding the abdomen. So when the patient verbalizes, masakit ang tiyan ko while holding the abdomen, that is a sign because that is guarding behavior, protecting or holding the area that is painful. So yun yung sign that we can observe on a patient with verbalization of abdominal pain. Another sign that we can observe, tingnan ninyo yung facial expressions. So pagka nagfo-frown, nakasimangot, or halos hindi mo na makausap, nearly crying na. So ibig sabihin, it gives us the idea that the pain is intense or severe. Okay, so ito yung mga objective cues na sinasabi natin. The one or the manifestations or presented problems that we can observe. So yun yung objective. So again, subjective is symptom felt by the patient. Objectives are signs that we can observe as healthcare provider. Okay, so yun yun sa atin sa assessment. Now let's go to diagnosis. Diagnosis, we follow the PES format. So please take note of this. What is PES format? So PES or PES. P stands for problem. So what is the problem? E stands for etiology. What is the cause of the problem? Or what are the causes of the problem? And S is for symptomatology or the signs and symptoms. Again, for diagnosis, we follow the PES format. Problem, etiology, symptomatology or the signs and symptoms. So how do we see, how can we see this in the diagnosis, in the actual diagnosis? So yung problem, minsan it is written as related to or RT. So related to or the cause of the problem. And then yung symptomatology is sometimes written as AEB or as evidence by. So what are the manifestations? So again, this is how we do the diagnosis. Now let's go to planning. Planning naman, we follow the SMART format. So what is SMART? S stands for specific, M measurable, A attainable, R realistic, and T time framed or time bounded. So going back to our example of pain, if we are to plan for the problem presented by our patient, which is abdominal pain, we have to be specific. So from the assessment, we would like to ask our patient, what is the scale or the level of pain that you are feeling right now? If the patient will give you a numerical coefficient, so the question is, if 0, no pain, 5 is moderate, and then 10 is severe, what level or at what scale is the pain felt by our patient? If the patient tells you that the pain is 9, so that is mostly, most probably nandun na siya dun sa severe type of pain kasi 9. So when we do our plan, we have to be specific. Okay, from 9 up to what level do you want to assist your patient or help your patient alleviate yung kanyang pain? So from 9, pwedeng ang goal ninyo is from 9 to 7. Yun, specific tayo, di ba? From 9 to 7, we are specific. Is it attainable? Yes. Mas attainable yung 9 to 7 kesa 9 to 0. Diba? Measurable, yes, because we have our scale. Is it attainable? Yes. From 9 to 7, mas possible yan as compared to 9 to 0. Is it realistic? Yes, we are being realistic. We can help the patient in relieving pain or alleviate the pain kahit na yung gradual, yung pagkawala ng pain na nararamdaman niya. Because we still have to identify kung ano yung cause ng kanyang pain. So how long do you want or do you intend to assist or help your patient is yung kanyang pain felt? So let's say after 30 minutes of nursing interventions, the pain of the patient from 9 will be lowered down or will be minimized from 9 to 7. So that is our how we construct or formulate yung planning. So again, follow the SMART format. S specific, M measurable, A attainable, R realistic, and T time bounded. Okay, so clear? Okay, nursing plan na tayo. Again, it is a formal process that includes correctly identifying existing needs and recognizing potential or risk. So we are not just focusing on the actual problem, but we can also see kung ano pa yung potential problems that may occur because of the presented signs and symptoms. Okay, example, kung yung patient ninyo may open wound, tapos yung open wound niya, clear na nakikita natin by merely observing yung wound ng patient may reddened surroundings. So nag-uus with, meron siyang redness and tenderness upon palpation. So this is a potential risk for infection. Wala pa most probably at the time of your assessment, pero possible na magkaroon ng infection because nag-i-start na mag-redden yung surroundings ng wound. And at the same time, it is tender to touch. So these are signs of inflammation. And then it will be followed by oozing of pus. So that is now a sign of infection. And then later on, fever. So these are potential problems. So meron tayong actual problem, meron siyang open wound. Okay, so meron siyang potential problem, potential for infection because of the break in the skin. So care plans also provide communication among nurses, their patients, and other healthcare providers to achieve healthcare outcomes. If you have developed your plan during your shift 6 to 2, then yung plan of care mo will be carried over to the next shift. So they can continue with the plan that you have formulated, or they can evaluate and reassess if the plan that you have formulated is helping the patient or the status of the patient. So nagpo-progress yung status ng patient natin, or nagko-contribute yung plan of care mo sa healing ng ating patient. So yan yung when we talk about continuity of care. Without the nursing care planning process, the quality and consistency of patient care would be lost. Okay, so walang direction, di ba? Earlier, we mentioned about order and direction. So without planning, pwedeng you go differently with the other members of the health team. So wala kayong goal set for the patient, or walang direction ang inyong actions. Okay, so this begins when the client is admitted. So whether in the clinic or in the hospital, planning begins as soon as the patient arrives in the facility or agency. Okay, and then continuously updated throughout in response to the client's changes in condition and evaluation of goal achievement. That is why we have the evaluation. This is for us to be able to know whether yung interventions natin is effective for our patient. If hindi siya effective for the patient, then we can restructure the plan of care that we have formulated. Kasi pwedeng we can discover underlying problem that contributes to the progression of the illness, and yung plan of care natin is not sufficient. So yung interventions natin is not applicable or appropriate. So we can restructure or reformulate our plan of care. Planning and delivering individualized or patient-centered care is the basis for excellence in nursing practice. So again, individualized, you have to take a look at our patient individually as a whole. So different from another patient. That is why it has to be client-centered or patient-focused care. Okay, so we have two types of nursing care plans. So we have the informal nursing care plan. So this is a strategy of action that exists in the nurse's mind. So as soon as you have seen your patient, you have the initial plan at the back of your mind. What will I do with this patient? And then we have the formal nursing care plan. It is a written or computerized guide that organizes the client's care information. So from the plan that you have in mind, you put that in writing, and now it becomes a formal nursing care plan. And this formal nursing care plan is subdivided into two. So we have the standardized care plans, specify the nursing care for groups of clients with everyday needs. So when we say group of clients, you cluster them according to their needs, pwedeng diagnosis, pwedeng yung mga needs nila on a daily basis. So pwedeng one standardized care plan ang i-formulate or i-prepare natin. But again, yung focus natin is client-centered, so we will go to the second division of formal nursing care plan, which is the individualized care plans. So these are tailored to meet the unique needs of a specific client or needs that are not addressed by the standardized care plan. Okay, purposes of a nursing care plan. Okay, first purpose natin here, it defines nurse's role. So remember, role natin ito. Kahit na tayo ay nasa program ng practical nursing, sa program ng Bachelor of Science in Nursing. Again, nandun yung word na nursing, and this is our role as nurses. So defines nurses' roles. It helps to identify the unique role of nurses in attending the overall health and well-being of clients without having to rely entirely on a physician's orders or interventions. Remember, yung attending physician, sa time ng admission, pwedeng nandun na siya, sa ER pa lang or sa outpatient department, nandun na yung attending physician. Pwede rin wala siya doon, but who will be there to attend to the needs of the patient? Hindi ba nurses? Okay. So once the patient is admitted, pagdating sa ward or sa kanyang room, who remains with the patient for 8 hours, for 12 hours? Hindi ba tayo rin as nurses? Ang doctors, they will do their rounds for probably 1 to 2 hours and then they will go to another patient. Pero tayo, buong unit, and we spent the whole 8 hours sa ating mga pasyente. So that is why tayo ay focus, patient-centered and client-focused ang ating approach. So we will not rely entirely on a physician's orders or interventions. Example, yung patient natin, upon assessment, may fever siya. So ang temperature niya is 39 degrees Celsius. Do we need to wait for the physician's order before we do action to the problem we identified? Di ba hindi? We can do our interventions. Later, we will classify these interventions into 3 categories. So we can do our intervention. We can render sponge bath. Di ba pag nasa bahay tayo, pinupunasan natin ang family member na may sakit. So yung forehead niya, yung sa neck niya, yung kanyang aksila, sa groin, kasi dito nag-accumulate yung more heat. So kapag we do this sponge bath, nagkakaroon ng process of heat loss. So nalo-lower down natin yung temperature. We don't need to wait for the doctor's order to render sponge bath. Okay? We can also encourage our patient to increase fluid intake if there is no limitation in the fluid intake of our patient. Okay? Why? Because yung fluid taken in by our patient helps in reducing or cooling down the body temperature. Okay, so there are several causes of increase in body temperature. So yung isa, most probably because of infection, and the other one is dehydration. So we don't have to wait for the doctor's order to encourage our patient to increase fluid intake. Again, yung fluid that is taken by our patient helps in cooling down. So these are nursing functions or interventions that we can do even without the doctor's orders. Okay, so next, provides direction for individualized care of the client. So it allows the nurse to think critically about each client and to develop interventions that are directly tailored to individual. So one intervention for one patient, another intervention for another patient if the intervention you have planned is not applicable or not working for the other patient. Next, we have continuity of care. So nurses from different shifts or different floors can use the data to render the same quality and type of interventions to care for clients. Therefore, allowing clients to receive the most benefit from treatment. So, yung afternoon nurse or incoming nurse may follow yung plan of care that you have formulated during your shift if they see that it is effective in alleviating the sufferings of our patient. Okay, so that is continuity of care. Next purpose is documentation. It should accurately outline which observations to make, what nursing actions to carry out, and what instructions the client or family members require. This is very important to take note of, especially if kayo after graduation, because you are on your second year, after graduation and now you are in the field, you have to take note of this. If nursing care is not documented correctly in the care plan, there is no evidence the care was provided. Okay? You can claim that you have given the medication to the patient. But if you have not written this down, that you have given the medication, it is presumed that you have not given or administered the medication. Same goes with the nursing interventions that we do. Okay? So if you have rendered sponge bath to your patient, but you did not record that you have rendered sponge bath, then it is considered as not done. So anything that is not written is considered not done. So documentation is very, very, very important in our role as nurses. So I hope this is clear sa ating lahat. So not seen, not written, whether you performed it, alam mo that you have performed but it is not written, it is considered not done. Okay, next. Serves as guide for assigning a specific task, a staff to a specific client. So there are instances when client's care needs to be assigned to a staff with particular and precise skills. So may mga patient category tayo. So yung patient natin that is for strict monitoring, it will be assigned to a senior nurse. So yung patient natin na may go home or for discharge, it could be assigned to a newly hired nurse. And then meron tayong patient that needs basic care, it could be assigned to nurse assistant. So yan yung category in the levels of care. So yan yung also one of the purposes of nursing care plan. Next, it serves as guide for reimbursement. So para kanino ito? For the benefit of our patients. The medical record is used by the insurance companies to determine what they will pay in relation to the hospital care received by the patient. So everything that was ordered or was administered, it should be recorded. So from the laboratory, diagnostic, medication, so lahat nung ginawa sa patient, it should be recorded because for the purpose of reimbursement sa insurance companies. And then we have, it defines client's goals. So hindi lang tayong nurses ang nagpo-formulate ng goal. This is a collaboration between the nurse and the patient. So yung patient natin has the right to choose or the autonomy to decide. So defines client's goals. It does not only benefit nurses, but also the clients by involving them in their own treatment and care. Okay, so we have here examples of nursing care plan. So ito yung 3 columns format for nursing care plans. So we have the nursing diagnosis. Okay, we discussed this already. You can use the NANDA or other tool with list of nursing diagnosis. And then we have the outcomes and evaluation. No reports. So ang problem natin dito is activity and tolerance. So remember, we do not use medical diagnosis. So ang problem is activity and tolerance. RT is related to. So this is the cause or the etiology. Exhaustion associated with interruption in usual sleep pattern because of discomfort, excessive coughing, and dyspnea. So based on the manifestations, pwede nating sa medical diagnosis, this could be bronchopneumonia or pneumonia if the patient is an adult. Okay, so sa outcomes and evaluation, magkasama yung outcome and evaluation in the second column. So no reports of dyspnea because that is yung ating manifestations here or signs and symptoms. Vital signs within normal range. So specifically yung kanyang respiratory rate. Okay, and then provide yung ating evaluation interventions. Provide a quiet environment and limit visitors during acute phase as indicated. Pace activity for patients with reduced activity. Remember, meron siyang activity and tolerance related to exhaustion. So what we are going to do here, if we want our patient to perform activities of daily living, that should be performed on pacing activities. So after one task, allow the patient to rest. and then continue with the second task, and then may rest period. That is what we termed as spacing of activity. So meron siyang period of rest in between. And the third intervention assists patient to assume comfortable position for rest and sleep. If you have difficulty of breathing, what will be the comfortable position? To be more specific, so we term this as semi-Fowlers, which is 45 degrees elevated, yung head of bed. So kung yung bed mo ay hindi na-move yung head part, then you can put pillow under the head and back of the patient. Another one is we have the high Fowlers or 90-degree angle. So yung isa semi-Fowlers 45 degrees, yung isa ay high Fowlers 90-degree angle or semi-sitting position. And then, kung hindi nga move yung bed, head of the bed, then you can put pillow for support. Another one in patients with asthma, they make use of the orthopnic position. So, familiar yung mga may family member kayo or you have seen an individual with asthma. Ang position nila, they are sitting but naka-lean forward and yung head nila is nasa overbed table or supported by pillow. So this is the most comfortable position for patients with asthma, especially those who have difficulty of breathing. So to be more specific in the comfortable position, so you can have semi-Fowlers, Fowlers, or orthopnic position. Okay, another example. So from 3, meron na tayong 4 columns. So we have the nursing diagnosis, goals and outcomes. Now we included yung planning. In the outcome, identification, and we separated yung evaluation dun sa last. So nursing diagnosis, goals and outcomes, interventions, and evaluation. So remember sa goals natin, it has to be, we have to follow the SMART format. So we have here 8 hours. So that is our time frame. Okay, so this is now the 4 columns nursing care plan format. And then we have, ito na yung utilized by student nurses. So we have 1, 2, 3, 4, 5, 6. So 6. Pero dun sa ginamit natin kanina or what was shown earlier or discussed, we have 7. Yung missing dito is the plan. Okay, so we have the assessment, diagnosis, outcomes. So patient will maintain optimal gas exchange. So yung ating plan is after how many hours the patient will be able to. So that is our plan. And then interventions, the rationale.
Magulang ka kaon na naman. Ano na nangababain nyo?
Okay, so scientific rationale. So manifestations, ang action niya dito is assess respirations. So remember dun sa mga samples na we have given, yung first intervention natin is to assess. Okay? So dito assess and this one is also assess. So assess respirations, note quality, rate, rhythm, depth, use of accessory muscles, ease, and position assumed for easy breathing. So when we say use of accessory muscles, usually if you have difficulty of breathing, we use the sternocleidomastoid muscle. So dito, sa yung malalim na part dito sa ating clavicle, so lumulubog yan nagkakaroon ng indention. Another muscle that we usually use when we have difficulty of breathing is yung intercostal muscle. So dito sa in between the ribs, merong indrawing or indentation if you have difficulty of breathing. So manifestations of respiratory distress are dependent on and indicative of the degree of lung involvement and underlying general health status as patients will adapt their breathing patterns to facilitate effective gas exchange. So this is the scientific rationale for the action performed by the nurse in the intervention. Okay, the second intervention, elevate head and encourage frequent position changes, deep breathing, and effective coughing. So these measures promote maximum chest expansion and mobilize secretions and improve ventilation. So these are the scientific basis for the action in intervention number 2. So I mentioned earlier that in nursing interventions, we classify this also in 3 categories. So we have the independent nursing intervention. These are interventions or actions that we can do without the prescription or the doctor's orders. So again, independent. And then we have the dependent nursing function or nursing intervention. These are interventions that we usually follow the doctor's order. So example of dependent is administration or administering medications. So mga laboratory or diagnostic procedures, so part yan ng ating dependent nursing interventions. And then we have the interdependent or collaborative nursing interventions. This is in coordination with the other members of the health team. If, for example, ang problem natin dito ay productive cough pero meron siyang impaired gas exchange, so may difficulty of breathing, pwedeng yung productive cough hindi niya ma-expel or expectorate, then we will seek assistance from the pulmonary therapist. So that is collaborative or interdependent nursing functions or nursing interventions. Okay, so that ends our VC for this afternoon. Thank you everyone for attending this VC. And we have here our references for the content of our slide.